At this time, there are three big questions that still need to be answered and are still unknowns. The first one is we don't yet know if this is more transmissible, as transmissible, or less transmissible than the current Delta variant that is prevalent in many parts of the United States. The second big unknown is whether or not this has immune escape, meaning if vaccines and prior infection will confer the same amount of protection that they currently do, or will confer some less protection. The third one is we don't know what the severity of this is, if this is more likely to land people in the hospital than prior variants were. However, as we're looking at this story as it unfolds, the number of mutations make it plausible that any of these could change, and we need to be watching this carefully. As of this time, there are no confirmed cases in the US, but given the number of cases being seen internationally, I would be very surprised if we didn't end up seeing at least some cases in the United States soon. Now, whether or not it becomes a dominant strain like it appears to have in South Africa or not, depends a lot on some of those unknown factors of transmissibility and what the impact will be of having a much higher vaccination rate in our population. South Africa's vaccination hovers around 25%, whereas the US is well over 50%. That just indicates that this is one that has a high potential to cause some continued spread and become a dominant strain. There are several other variants of concern that have been tracked, and some of them, like Delta, have become significant problems. For the general public, as of right now, I would be more concerned about Delta because that's what we're currently seeing as a surge in our communities at this moment. And this is why the best thing you can do to keep yourself safe and keep yourself protected remains getting vaccinated, or if you're eligible, getting a booster. We don't yet know how much protection those boosters will offer against the Omicron variant if and when it comes to the United States, but there's every reason to believe it will offer some. The best ways to stay protected against COVID-19 remain the same things that they've been for most of this year, namely, if you are vaccine eligible, get the vaccine. If you're booster eligible, get the booster. There's every reason to believe that that will continue to offer protection against the current circulating strains, and probably will still offer some protection against upcoming strains as well. We just don't know how much. Also, wearing masks in appropriate settings, such as areas where other people are unmasked or you're unsure of their vaccination status, is appropriate. And finally, if you yourself have symptoms that are concerning for COVID-19, checking with your healthcare provider and getting appropriate testing so that you don't expose others.